Welcome to the Three Little Pigs podcast. I'm Shannon.
I'm Wes.
I'm Jackson.
And today we are joined by our first guest. Our guest, his name is Mike Alzheimer. Mike, say hi.
Hello.
So Mike used to lift with myself and a few other friends. He used to work with me at Big Sky Barbell. Mike, tell us a little about yourself.
So yeah, as Shannon was saying, I met Shannon through Big Sky Barbell. I was a personal trainer there, and Shannon was there before me. And so my plan is I kind of wanted to get some personal training experience before I went to physical therapy school. So I was at Big Sky Barbell for about a year, and now I'm in San Francisco at UCSF, just finishing up my second year of physical therapy school.
How's that been treating you?
It's been good. Yeah, it's been a really good experience. It's been cool seeing like how I can start incorporating kind of the rehab principles and applying it to even my own training. So it's been really beneficial. It's been really, really good experience.
So tell us a little bit about your lifting experience, competitive experience, and stuff like that.
So yeah, before Big Sky Barbell, I was just kind of like your everyday general like meathead. I just kind of did like stuff you'd see from like bodybuilding.com and more into the bodybuilding scene more than anything. But I've been training consistently since high school because like football and whatnot. But when I met Logan and Big Sky Barbell and Shannon, I kind of got more into powerlifting and maybe more into the performance side of training. So yeah, since then I've been doing powerlifting consistently, done a couple meets under my belt and trained some people for some meets. So where I'm at now, I'm more interested in kind of performance more so than like the aesthetic or other side of lifting. But yeah, that's kind of what my general background is with it. So
nice. So while we have Mike here, he's here visiting from after finishing his last
spring break from clinical rotation.
Spring break?
Yeah.
We're going to talk about recovering from injuries, how to deal with injuries in terms of like while you're training, stuff like that. And he has a unique perspective as a PT student and obviously working with patients and stuff like that in his clinicals. And then I think we've all dealt with injuries, all four of us, whether they be traumatic or just, like random back pain or just feeling beat up. If you're a power lifter and you're training hard, eventually you're going to feel beat up. Eventually you're probably going to get injured at some point. Hopefully you kind of like prevent that for as long as possible or altogether, but it's kind of an inevitability if you push yourself pretty hard.
Mm-hmm.
So why don't you tell us a little bit about how your philosophy in terms of injury recovery and rehab and how it relates to your strength training or your performance background.
Yeah, I think what's interesting with performance, and it's kind of like you have to deal with the fact that you know that you're pushing your body to the limit and that you are kind of increasing your chance of injury. So it's kind of counterintuitive to what like typically you'd hear in the rehab setting. It's like you don't want to and you try to avoid the things that cause injury. But if that is kind of your goal and that's kind of what you want to do, like maybe it's something you're passionate about or something that's really important to you, it's interesting. Like what I've seen is this like how if you still want to work in that realm and you understand the risks and benefits of it, but how rehab can play a big role in that and almost like preventing the injury, understanding the injury, and keeping kind of longevity in something like powerlifting, for example, because you are pushing it to the max, you're trying to lift the max load that you can. How if you have some of that rehab knowledge or understanding like how to prevent those injuries, how it can kind of increase the length of your career and avoiding the injuries. And, that's if in powerlifting is what really holds you back is, not necessarily just going through the strength training program, but is when you get the injuries and how that can kind of, set you back like 3 steps. And then it's like, how do you get back or how do you get back to feeling confident even under the barbell again? So having knowledge in both has been really beneficial to me because I love powerlifting. I love pushing myself to the limit, but understanding, maybe kind of the anatomy and injury and tissue recovery from the rehab side and what I'm losing in physical therapy, it's really actually helped my powerlifting career quite a bit and kind of preventing some of the common injuries you'd see. So they definitely can go hand in hand, and I think it's beneficial to have people that are really, really like these guys, like trainers in the performance realm. And then you also have someone that can help you in the rehab side as well, and how they can kind of work together and kind of incorporate to really, really help their athletes out. So
I think, and Wes and Jackson can probably say the same thing, that just being, at least in my experience with my own injuries and clients' injuries, just little feeling beat up, nothing traumatic, but just having the knowledge of programming and progressive overload and adaptation and stimulus is kind of like the big picture of how you recover from an injury in the first place. Even if we're not rehab professionals, just understanding that you got to pull back for a little while and then gradually build back up and gradually expose your body to certain stimuli is very beneficial in terms of rehabbing from injury.
I think with that, I like what you said, that as soon as you become competitive in anything, injury becomes an inherent risk.
mm-hmm.
And that's not necessarily a bad thing. That's just one of the sacrifices you make to be competitive in anything, and even if you don't necessarily compete regularly in powerlifting, but you're competitive in the sense that you're trying to constantly push your total or even your gym numbers, then you're technically still being competitive. And I think that no matter how long you do it, eventually something will happen. But I also think, going along with what Shannon said, it's important to be analytical about your own injuries, and to not essentially be like, oh, yep, this is the one. I'm going to wake up in a wheelchair tomorrow,
Mm-hmm.
And to be analytical about it and say, okay, I need to pull back. Or even to be analytical to the point where you're like, okay, this one is actually worse, and I feel like I do need to seek out a professional PT or whoever who actually has insight on how I can recover from this.
Yeah.
Yeah, I would say my injury experience in powerlifting has never been so serious to the point of, I guess, total cessation in training or having to see some sort of professional, but more of how can I manipulate my training to train around this specific thing. What I see a lot, especially with clients or people we get, like these guys are saying, when you're trying to push performance to a high level, you will have slight aches and tweaks that I think a lot of people pass off as like, these are injuries. And it's like, well, maybe not, and I feel like a lot of people are very, very quick to immediately stop training rather than being like, okay, what can we do to continue to train to alleviate the pain most of we can so you can still perform, still accumulate volume without completely detraining in general. And again, I'm not a rehab specialist or professional, but it's just more like my experience comes from troubleshooting during someone's training cycle. Like, okay, what can we do to work around this? And then what can we do from like a psychological standpoint tonight to not continuously think about this and be, I guess, hyper emotional about that injury. It seems like when something happens, especially if it's a previous injury, people are very quick to freak out, even if it's a very small thing, and previously it was something bad, and they have a emotional responses that seems like can get out of hand very quickly. So I think as a coach, it's like, okay, how can we keep you stable emotionally, but how can we troubleshoot and figure out a way that you can continue to train around whatever's going on, whether that be manipulating your training, seeing a specialist in rehab, but to figure out a way to like deal with it, move forward, still get better without giving up.
Yeah, the last thing you want to do when you get injured is freak out and catastrophize what happened to you, especially in my history of kind of like, I've had like back injuries and stuff like that, and I've had to take time off lifting, and if I completely stop, it gets worse. The last thing you want to do is stop moving, and the old axiom, movement is medicine. It totally is true that unless you're like have the worst case scenario kind of injury, moving is always better than not. It's not always about pulling away from your training. It's about adapting your training and figuring out what you can do. Maybe your back hurts when you deadlift. Okay, so how do we work around that? maybe we pull from blocks. Maybe it's easier to pull from a height where there's a less compromised position, and then do that, and then you progressively lower the block height. Maybe the blocks hurt, so you do a trap bar deadlift from blocks, or just a trap bar deadlift, something to train the same movement, and then gradually progress yourself back to that movement if it's painful. Yeah, what do you think about that, Mike?
Yeah, no, and I even think for like injury prevention, that's key, because like, let's say for example in the squat, like your knees are hurting, and then you decide to stop squatting, and then let's say after a month or two, like the pain goes away, but you haven't done a squatting pattern movement or gotten to squatting, and you go back into squatting, like one, you're not going to know what caused the problem, and you're going to be so detrained from like a squatting and that movement, like you're running a high risk of getting injury again. Like, so exactly what you guys were saying, like I think if I was looking from the rehab side, instead of like just stopping or completely avoiding the movement, I think like Shannon was saying, you have to scale it back and like look at these movements as like a spectrum. Like if the highest end of the spectrum is like a heavy squat, you can go all the way from like decreasing the range, like a box squat, or doing something really light like body weight. But you want to find like from the PT side, like where in the movement it's causing pain, or as you're assessing their movement and their movement quality, you can kind of figure out why now is like pain coming up from their knees, or why is it flaring up. And you can kind of, you could figure out multiple things. Like, is it like an actual like acute injury, or is it just overuse? Maybe their frequency or training. And that's where I think like PTs need to be working with like the trainers and understanding that too. And like understanding the strength training part of it. Like what I see in the rehab setting is like, oh, your knees are from squatting, then squatting is bad. But if you look at their training, you could just realize like, well, maybe they just increased their frequency just recently and now their knees flare up. So if you can understand from that side, like all they need to do is change the stimulus, back off a little bit. You don't just tell them to quit squatting, because that will just keep on hurting your knees. You can make micro adjustments and keep them doing what they love, and then also prevent them from getting injured. So
there's a lot of factors in the onset of pain and injury, but I think, as you mentioned, kind of overuse and stuff and increasing the frequency. Usually the biggest factor that I find is literally just load management. Yeah. Doing too much too soon, or doing something new and too much too soon. If you, as we talk about, just progressively start small, work big, you can adapt to a lot. But if you just all of a sudden do a shit ton, or do a lot of frequency, do a lot of volume, do a lot of weight, that's when injuries happen.
Yeah.
And in terms of overuse injuries, same thing. It's usually just improper like load management. When I say load management, I don't just mean weight. I mean volume. I mean frequency. Just all the factors that go into that.
Yeah. And one thing, and I'm not, for my example here, I'm not going to call them injuries, because they're really not. They're more like, kind of dings and bruises from training, or even like for me, most of my, injuries have come from outside of the gym. Whether that's, you go on a hike and you roll your ankle, or whatever that may be. But playing with variation is one way to work around that as well. And I think that even if it's not like a real injury, but like your client has a hard time getting into a certain position, you can play with that position. Like for the deadlift, if they say, oh, my back hurts while I'm deadlifting, then you can go to block pulls. Or if, hey, for some reason I feel really uncomfortable with high bar squat, then you can mess around with a low bar squat, or even like we've done the safety bar squat before, or even, if it's just for GPP work, we move to like a goblet squat or even a box squat. Like you play around with that variation, as long as it still allows you to accumulate volume and still allows you to train, then I think that's a good approach to have as well.
And I think it's awesome when you hear like, trainers understand this principle, because like I think that's something they need to incorporate first. And then after doing that, if you adapt the stimulus and you do something like going back to a goblet squat, blah, blah, and then you're doing this for a couple of weeks and then they still have an injury, it's like, or something, it's still nagging pain, that's when you'd want to refer them to like a PT or somebody that's going to help them with their pain management, because then it could actually be an injury. So it's like before, you freak out, you're like, oh my gosh, like something's wrong. Let them see if, maybe it is just like the tissue stimulus is too much, you just need to back off. And if that's the case and then it still hurts, then, you can find out if there's actually is like a damage, like you actually did, injure something. So.
Yeah. And I don't think it's ever a bad thing if you're in pain, especially if you don't have the background that we do in terms of knowledge, to seek out a professional. Just try to find one that has experience in what you're doing.
Yeah.
Mm-hmm. The last thing you want to do is go to a PT or a doctor who doesn't lift, because they have no knowledge of it, they have no background in it, They have no context of why you're doing it, why you want to do it, how much you're doing it. Whereas if you go to somebody who has that experience or does it themselves or works with a lot of people that do it, they know you want to do it, and so they know how to get you back to it.
And they'll know how to adapt around it as well.
Exactly.
And you'll understand maybe more of the mechanism of the injury, because if you don't really understand the mechanics of some of those lifts or how they're incorporated, like, for example, if you don't know how to do a proper bench press form, and like that could be what's causing their shoulder pain, is just their form. So if you have like a rehab specialist that at least knows those principles, that they could even help you correct that as well. So it is important, I think, at least if you can, if it's available, trying to find a clinician that has experience in what you're doing, if that's what your goal is like to keep pushing the strength, to be a performance and stuff like that. So,
and I think too, it even goes farther than just even knowing what you're doing. I feel like a lot of doctors will, at least for my experience, whenever you get hurt doing something, they try to push you away from, like, oh, well, you do realize that if you keep strength training, you're going to be hurt for the rest of your life. If you ever hear something like that from a doctor, they're not a good fit for you. Because I think that especially in the rehab setting, for a PT especially, if they're not trying to aid you to get back into whatever you were doing before, like if you absolutely enjoy lifting, and we won't even use lifting for example, like if you absolutely enjoy cycling, right? And your doctor says, well, if you keep cycling, your knees are going to explode.
Yeah.
That is not the right.
I just feel like it's an easy out for the clinician, because then
exactly.
they don't have to look at. It's hard. I mean, I understand it almost from like a doctor's perspective, especially like when they're so short on time and whatnot. Like if they don't have the time to fully assess your movement and like look at everything from like, because this isn't just like even stimulus. Like it can also be your recovery, like how you're sleeping, what you're eating, like multiple things can go into this. So you really have to have a clinician that's willing to spend a lot of time and look at the whole picture to like, instead of just giving you the easy out, like, yeah, that hurts, stop doing that. It takes a lot of work, and it can take a lot of trial and error before they can kind of figure out where are the missing holes in your programming or whatnot, or in your lifestyle that's causing these injuries. So, but I think, yeah, if you can find a clinician that's willing to work with you, and I think, going through PT school, I think you have the expertise. It's just like you have to have someone that's like willing to go through that almost like process of like, really, really picking at it, really, really assessing you as a whole person, and then figuring out like, yeah, we'll do everything we can to work with you. So,
yeah, as Jackson said, I won't even be apologetic about this. If you go to a doctor or a clinician or anything and they tell you to stop doing what you love, minus a few red flags, of course. There's always
there's you always have cancer.
Yeah,
it's
there's
like,
always a few things that stop doing that, or
Yeah.
stop doing it stupidly. But if a medical professional tells you not to lift or tells you not to do what you love, and whatever it is, turn and run. Find somebody else. Get a second opinion, because most of the time, again, minus those red flags, your body's not that fragile.
Yeah.
You can still do it, maybe in a different way, maybe scaled back a little bit, but you can get back to where you were, and you can do what you love.
yeah, definitely.
So I got a question for you, Mike. If you guys have talked about this, and this has just been fascinating, we've been reading some papers on this, how would you approach someone who has maybe like mechanically something is wrong? They have no more cartilage in a certain area, something's wrong, but it's asymptomatic, and perceptions in pain. Because one thing I've noticed, even from doctors, like when I was playing football in high school, I went and got MRI on my knee because it was bugging me, and I had like just a MCL, like a small MCL tear or something, and the doctor was like, "Oh my God, you have knees of a 9-year-old man," and it really wasn't all that painful. It's kind of just nagging and annoying, but having a professional, someone in a position of authority, give you an interpretation that's like catastrophic almost.
Yeah.
And then your pain starts to get it blows up, and you're like, oh my God, now you're like hyper aware of what's going on, even though it really wasn't something huge.
Yeah.
You guys ever talk about that, like dealing with patients and like wording and trying not to exacerbate someone's issue?
Yeah. I mean, we've kind of, in PT school at least, kind of talked about like the language around pain and how you talk to your patient about that, and kind of how you can distastrophize it and like make it just so much worse than it actually is. Like I think it's called like the nocebo effect.
Yeah.
And it's really interesting if like you look at some of the literature, like Explain Pain is a great book, and it kind of talks about that. Like it's a weird. It's like, you know, for example, someone like could get an arrow through the neck and they may not feel it. So there's definitely trauma, but like the pain signals aren't there.
Yeah.
So it's like the understanding the pain and then how it is tied into your almost perception of it. So as a clinician, you really need to be careful with your wording, because if they honestly, like, the MRI might show something, but they're not symptomatic, and then you just like, you know, freak them out and make it worse than it is.
Yeah.
I think it actually can, like, you know, create a fear avoidance behavior, or like, you know, you'll even start feeling that pain. So I think how I look at that is like, really you have to look at a symptom-based approach. If they're not having pain, but there's something showing up the MRI, you want to be careful with and be aware of it. But like, I think you can keep doing what you're doing, and just it's something you want to monitor and have in the back of your mind, but not like realize that if you're not experiencing the pain, if it's not having like functional deficits, you are probably fine like keeping to work with it. And honestly, like, things like staying active are so much more important than just quitting. What I hate to see is like, you know, someone will look at their back and like an MRI and it's like, oh, you have like a disc or something, or degenerative changes, and that person becomes more sedentary. It's like, avoid the things that cause pain and avoid things that make it worse. But if you can keep doing what you're doing and it's not causing you pain, there's no functional limit to what you can do. Like, you just keep pushing through it and just be aware of it. And, you know, maybe if, for example, if you have kind of a bum knee that has like a previous injury, why not work on like working like muscles that can kind of functionally work around it? Like, okay, like if this knee is not as stable, like let's work on the stability of my hip and whatnot, and like the muscle that kind of like, you know, will help stabilize the knee, like work on those muscles, strengthen those, work on your stability. Maybe so now, instead of just being so focused on like pure power and strength, maybe you could start incorporating more stability and mobility, and like just making sure that, you know, your movement quality is better. So you might just have to adapt your training, but never would I say until like the point where like symptoms are getting really bad that you like back off or have to quit doing what you're doing. I think you can, like we were talking about earlier, you can adjust your training to kind of work around an injury or a compensation. So
this is a super interesting topic for me as well. That's what I've been reading a lot about, just pain science in general, and how, you know, it's multifactorial. It's biopsychosocial. So there's structural and biomedical parts of pain. There's also, you know, what's going on in your life, your psychological factors, you know, stress, you know, maybe you just divorced your wife, stuff like that. That all goes into painful experiences and like past experiences as well. So maybe you broke your back or like fractured something a year ago and it's completely healed structurally, but you still get like symptoms of pain, and that's just because your body, not to say it's all in your mind, because pain is an experience. It's not.
It's real. Like
it's
you're
real.
You're feeling it.
Yeah,
like
you're feeling the pain is real.
Yeah.
It's not all in your head, but there's just so many factors that go into it. I think this might be in an Explained Pain or by the same author, but he tells a story. I think it's Lorimer Moseley.
Moseley and Butler. Yeah.
Yeah. I can't remember which one it was. Tells a story about how they're hiking in Australia, right? And this guy, he like just through some tall grass, feels like a little prick on his leg. He thinks, okay, it's just a twig. I was scratched. So he just brushes it off. Okay. Turns out he was bitten by the most poisonous snake, or the number 2 poisonous snake in Australia.
Yeah.
And next thing you know, he's in excruciating pain, just the worst pain of his life. He is barely rushed to the ER, barely survives, whatever. Okay. Well, a few years later, or a few months later, he's walking again, hiking again in some tall grass, and he feels a little prick on his leg, except this time it's the worst pain he's ever experienced. 10 out of 10. It just kind of like, it reminds him of that snake. Turns out it was only a twig. So that kind of experience just kind of goes to show about how previous experience, you know, belief systems, and other factors go into pain. It's not always that your back's about to explode, your back hurts, and you think, if I do another squat, I'm going to be paralyzed the rest of your life.
Yeah.
Or it's just, your body's not that fragile.
Well,
there's so much that goes into it.
And I think your body, it's just like amazing what it's capable of actually recovering from and dealing with. Like I recently read The Gift of Injury. I don't know if you've read that. That is just amazing. It's like Brian Carroll's story. He works with this professional, Stuart McGill. And Brian Carroll is like this elite power lifter who's like squatted like 1,000 pounds like over 50 times or something. But his back had gotten really jacked up. Like his SI joint was literally split. He has all these bulging discs, like just a screwed up back. And like you were talking about earlier, like all the medical professionals, like I won't even give you need surgery for one.
Yeah.
I won't even go to have surgery on you until you say you will stop powerlifting. Like you are destroying yourself. Like you're done. Like you have to quit. And this guy was like, this is his life. He's a coach. He's powerlifting is like a huge part of his life. And it was like depressing him and just like destroying him as a person. But he eventually stumbled upon Stuart McGill, and Stuart McGill was able to assess like what he's doing in everyday life that was just exacerbating his pain and like not allowing those damaged structures to actually heal. And it was amazing, like when he had worked with him and he'd give him exercises, correctives, all the things that he was doing to aggravate those things. His body was actually able to recover from that, and he came back to powerlift and beat his old total. And he has, from an MRI perspective, or like from a diagnostic, like if you look at it, it's like it looks like you're destroyed, like your back, your SI, everything is destroyed. But honestly, like you at least got to try. I think working around and like finding a professional that knows what you're doing, and maybe like a physical therapist or whatever. That I think before you go to that surgery route, or before you like make it like this is the end of my career, it's worth trying to rehab it and seeing someone that can maybe assess the things you're missing or the things that other people are not seeing, and like your movement quality. And that's what it's amazing, like your everyday life, how that can even affect it. But yeah, like if you would have just listened to those doctors and like he's like I'm screwed, but it's like that's false information, honestly. Like you got to say like this might be a last resort, but there's other things to try first. And that's where I think where physical therapists and rehab kind of come into play.
Yeah.
This is kind of a cool story. So Megan, my wife, when we were in high school, she tore her ACL at a basketball camp.
Yeah.
But she didn't know that at the time. She essentially just played it off, but she played it off for an entire year. So she played 2 seasons on a torn ACL. And it wasn't that it wasn't bugging her. It was kind of similar to Wes's, where it was painful, but she, played in a state championship volleyball game, and they made it to state in basketball.
Yeah.
And it wasn't and that was her senior year, and it wasn't until after that she was like, you know what, now that sports are done, I'm going to go get it checked out. Sure enough, ACL is actually torn, and they were like, I don't know how you played 2 seasons on this, right? But she had played 2 seasons as a starter and a captain on both teams.
Yeah.
And it was one of those things where it was just, mentally she wasn't going to let like a little, what seemed to her like a nagging pain, slow her down at the time, when it was actually a, fully torn ACL.
Well, it just shows that I think your body is amazingly adaptable. It can work around previous injuries or injuries that you're currently having, and
it seems like perception it's fascinating too. I read a study. I can't remember exactly who the author was, and it wasn't even a training study. It was a study on psychological stress in like life partners or people in general, and they brought them to a lab, and they're studying them, and they had different groups, and in the groups they injected some sort of thing that caused a histamine response, and they looked at basically time to heal, and they had different interventions in each group. A group that was like relatively low psychological stress, a group that they almost provoked the couple to try to get them to fight, and then I can't remember what the other group was, but the group who was very calm, got along great, and had low psychological stress, or reported low psychological stress, on average recovered like 3 days faster than the other groups.
Yeah.
It's just fast. I think it's interesting, and I'm not a professional in this. I'm just interested in this stuff because it's fascinating to me, how perception, and it kind of goes back to the thing that I think all of us have learned in exercise science or physical therapy, is the saying a stress is a stress is a stress. It's like all these things.
Or stress,
like Shannon was saying, it's biopsychosocial. It's not everything is mechanical, even though there are things that can cause mechanical stress, but not everything is mechanical. So if you have, a crazy life, crazy relationship, your stress levels are through the roof all the time. People, as a coach, people talk to us about like, what can I do to better recover? And they want to add stuff.
Yeah.
It's like, maybe you shouldn't add anything else. Maybe you should try to get this stuff in check, do what makes you chill, see if that helps, rather than just keep adding more stuff into your
that's
life.
our responsibility, I think, as trainers and as PTs, is like you cannot add to that stress. Like I see no reason, and like especially when you don't really know what the outcome's going to be, to make it worse than it might be. Like you're done. It's like I hate when people say the phrase like you have the knee of like a 6-year-old man or the back of a 80. It's like that is not accurate for one, like how functional you are, and it's like you're just honestly like now you're getting this fear behavior, and it's like stressing that person out. And it's like impeding even if they had the possibility of recovering. So I think you really do have to be careful in how you approach, even if you guys have a client that's injured, it's like you don't want to freak them out. You don't want to freak out yourself as the coach. And, I get more information and like work around it first before, come to any conclusions. So.
Yes, all kinds of stress isn't always mechanical, but it always has a physiological effect.
Yeah.
Yeah.
It's super interesting. what you mentioned, because just imagine if you're designing a program for somebody, and if stress can make them recover 3 times as long, imagine what a wrench that throws into a program of how much volume and intensity they can handle.
Yeah.
And so you have to take that, different topic obviously for another day, which we've kind of covered a little bit, but you have to take all that into account when you program for somebody. Otherwise, those injuries will happen. Okay, it's not just training doesn't happen in a vacuum. It's not just it's not an isolated
and
event.
That's tough to individualize someone's programming and whatnot, because it's like, okay, this guy works a 60-hour week, and this guy's only working like 40 or something, or this guy's going through divorce. It's like, maybe you should keep back and tone back a little bit on, like, let's not do RPE 10 all the time or something like that. You got to tone it down a little bit. So it's like, and that's the whole thing, is like, you need to recover, and that's the whole stimulus. It's like, if they can recover from it, maybe this guy's going to do better at like RP 7 or just toning it back like 90% of the time. And then someone that's like got less stress, easier lifestyle, they can handle like longer training hours or more volume or higher intensities. So it's a huge part of injury prevention, I believe. Yeah, I think that's a really good point. So
I got a question. We talked about this a little bit the other night, but powerlifting definitely has a stigma in terms of general population, and lifting in general has a stigma in the rehab setting. I know where you go to school and other PTs we talked about, many PTs I know don't have lifting experience, as we've talked about. So how has your lifting experience kind of affected, or what kind of lens is it put over what you've learned in PT school, and what have they taught you that kind of conflicts with your knowledge as a strength professional?
Yeah, I think what it really stems from is, like you were saying, like, people don't have experience in like maybe strength training sports like powerlifting. So, ignorance, you're almost going to fear it because you don't really understand it. And maybe you haven't seen, like, honestly, like what people are capable of, or like how actual dangerous these movements are. And I think, it comes from a good place. Like, rehab specialists, if they have like this stigma against like maybe things like powerlifting, is like they just want people getting hurt, and they think this is what the cause is. And I would say the problem is, like, a lot of people do, like, if you look in a typical gym, it's like they don't know what they're doing and they're getting hurt. So it's like, well, duh, like, going to the gym, lifting heavy hurts you. But honestly, if done properly, if done scaled correctly with the right training and frequency and volume, and you have good coaches that are watching your form, like, your body is capable of handling so much. Like, it's such an adaptable system. It's like it can handle these heavy loads. Like, it's not destroying your body. Like, your body is just adapting to that stimulus and getting stronger and more resilient and more robust. So I think having seen so many people like in the strength realm, and like how you can like it isn't like just naturally like, oh, this is just bad for you, like it just hurts you no matter what. And I get, like, if you're gonna, like we were saying earlier, like reach peak performance, you're just increasing your risk of injury because you're pushing it to the limit. But to say that like doing things like squats and deadlifts are just bad for you in general, it's all about like circumstantial. Like, if you were just to use that to help somebody just get general strength, those movements and like strength training and barbell movements are not inherently harmful. Only time it's ever harmful is if it's not done correctly, or if they're done with too much intensity, or like if somebody is just obviously pushing it to limit. But I think I come from a place where, like, obviously I love the barbell sports, but I can see actually how they could be beneficial in the rehab setting, and not something that we need to shy away from, but something that you can use to actually really help patients like progress farther and be more functional. Because, like, honestly, what's better than a deadlift to strengthen your back? You can only do so many like little accessory movements with bands and whatnot to strengthen your back. But if done properly, like the deadlift can be one of the best ways to strengthen your core and back and give you a more resilient and robust back to prevent injury. Like, who's gonna be more resilient in, like, let's say a sports like football? Like, whose back is gonna be stronger from a tackle? A guy that can deadlift 200 pounds or a guy that can deadlift like 500? That guy's just gonna have a more resilient body that's used to stimulus, used to heavy loads. Like, he can just handle more impact, more even just like the stimulus you get in a football game. Like, his back is just stronger and more resilient. So I think you can definitely incorporate the two for sure.
Yeah, for us, barbells are our sport and our passion, but even in the rehab setting, they're a useful tool.
Yeah.
They're just a way to progress the stimulus and do it, obviously, in a useful manner.
Yeah.
The misunderstanding, I think, buds from people don't understand how, at least good powerlifting, good coaching, stuff like that. People don't understand how intelligently it's planned out and coached.
Oh, it's a science. Yeah.
It's just like rehab in the sense that you are, providing a stimulus, and then you're progressively changing it.
Yeah.
So for people to say it's dangerous is just a misunderstanding and lack of knowledge of it.
Yeah.
Well, most of the time too, rehab professionals are only seeing the lifters who have messed that process up.
Yeah.
You
yeah,
know?
You're seeing the hurt ones.
Yeah,
exactly.
exactly.
Yeah.
So,
Yeah, I think barbells, going back to what Chan said, I mean, I think barbells are looked at as intimidating for some reason. But I like barbells in training in general. Cause
I like barbells.
I like barbells.
Yeah. I like to lift.
I like that they're very dosable, meaning that you can literally micro-load them.
Oh, yeah.
And from a gym owner standpoint, they're relatively inexpensive. Even a really good barbell is less than a piece of equipment. It can be used for multiple different things. It requires some form of stability or balance in the sense that a lot of these movements, you're standing up, you're working through a full range of motion, you're trying to keep the barbell over your center in a straight line.
What?
And yeah, it just seems like, I don't know. I don't necessarily, I think it's the fear of, I don't know, or I don't know how to coach this, or it looks intimidating, or, oh, we're seeing injured athletes, not all the ones who aren't being injured, and associate that with dangerous or danger.
What these movements are, like the squat and the deadlift and press, it's like these are just everyday movements. Like you squat down every day and you pick up things from the ground. That's just a hip hinge. That's just a deadlift. So using the barbell is just a way to increase that stimulus, So to say that, like, it's the same thing as saying those like movements are dangerous. It's like that's what we have to do in everyday life. So it's just like, it doesn't make sense to me to say that the inherently dangerous movements, because it's just like all you're doing is adding a stimulus to a movement you naturally do.
It's funny because powerlifting, in terms of stats, does have one of the least amount of injury rates compared
for sports,
to
yeah.
as a sport has the least amount of injuries compared to soccer, basketball, football.
And just think about it, it's such a controlled sport.
Yeah.
You have spotters. It's like no other circumstantial things where someone's going to sideswipe your leg while you're deadlifting or squatting or something. It's like you have people watching. You're doing in a slow, controlled movement. Like it's really like this slow motion moving a heavy weight.
Yeah.
And if you were to ever fall, like you have someone to help you. So it's imagine in soccer, someone could just sideswipe. You're blindsided. Like the risk of injury is so much higher.
You're working literally only in one plane, in the central plane.
Yeah.
It's like that's the least risky thing. It's just the fact that, and this is true for any sport, competing isn't healthy. There's a difference between health and trying to compete at the highest level.
And as a physical therapist, I'd never be like, yo, bro, let's test your 1 rep max. Like, I'm not trying to do that. I'm just incorporating the barbell movements and strength training in general, because let's say on the spectrum of the rehab process, like I'll be doing the typical rehab things, like things with banded or lightweight or hardly any stimulus, just to start training those movement patterns to get them back to doing it. But I see no reason why you can't, like, once you get to a certain threshold, like, why not throw in just a barbell with no weight on it and start doing the hip hinge? Why not start deadlifting? And then, you can take it from there and really use it to a point to be like, okay, this guy is back to where he's back to his initial, like, where he was before injury, or if not better, because now he's strength training. He's lifting heavy. Like, his back is better. He can lift 135 pounds with the deadlift now and his back doesn't hurt. And imagine what that does for the client. Like, oh my gosh, like I was scared to tie my shoes and now I can deadlift 100 pounds, 200 pounds. No. Like that's why I think the deadlift, even for the example, is like a great tool, because it's going to give confidence to those people.
Talking just about the psychological factors, if somebody's very fear avoidant and has a hurt back, but you teach them how to deadlift like 90 pounds, they're like, holy shit, I can pick up 90 pounds now.
I can pick up my baby, I can pick up my kids,
to the mental aspect and the psychological aspect.
Yeah.
They're happy, and then maybe even that just kind of decreases pain and stuff like that.
Yeah.
So just instilling the confidence by basic strength is a valuable thing too. Wes, I know you're going to say something.
Yeah, it seems, I like what you're saying, Mike, too. It also seems interesting when you're dealing with someone who's potentially injured, but they're a previously trained athlete.
Yeah.
I see this in sometimes, not all the time, but in some physical therapists too, kind of forget that this is a trained person.
Yeah.
And so they prolong the period of time that, they're in this like rehab phase, and it's like, okay, this person was previously trained, is very strong, and it seems like now that you've kind of established everything you needed to in the recovery and rehab process, like let's get them back to where they were. And it seems like it's in some physical therapists, not all, but like they just only stay in that one realm. It's like only bands, only body weight, only this stuff. It's like, well, you need to progress.
And yeah, it's the thing. It's like if you're a competitive athlete, like you're just not going to be confident going back. Like, well, I saw a PT, but the most I ever did was like air squats or like banded stuff.
Yeah.
So if someone's goal, and that's like, that's specific to the patient. Like if a patient does not want to squat heavy, like I'm not going to load him heavy on a squat. But if this guy was like an athlete of some kind, I imagine that he has some kind of strength training in his general preparedness for whatever his sport is. Like if he knows he can squat 225 again, like that will instill that confidence. And you need to know that he can handle that as well. From a rehab side, it's like, all right, this guy had injury. Like, is he ready to go back to his sport? Like, you don't want to just know based on like, oh, his pain went away, because you really don't know if he can handle the stimulus of something competitive. So using those movements like barbell movements, it's like, okay, this guy can lift heavy. Honestly, like he's able to hand a very stressful stimulus. So this is like a good sign that he's ready to get back to a sport. And like we were saying earlier, like I know going back to a sport, like you were saying, example of that guy, like if he's squatting heavy, he's going to feel way more confident going back if he wants to go play again or do his sport or perform in any way. So.
Yeah, and knowing where to go after injury is super valuable too.
Yeah.
Like PTs, because of insurance, only see a patient for a limited amount of time, and like once they hit benchmarks, they're get out of here. But patients should be educated as to how to keep progressing that, because eventually, talking about stimulus and adaptation, eventually that stimulus isn't a stimulus anymore.
Yeah.
Okay, so you need to progressively increase it.
Yeah.
So maybe the band works to help you out for, a week or two, it gets you out of pain.
A couple sessions, but
yeah, a couple sessions.
I mean, especially when you're so limited, that's what I mean. If possible, you need to progress as soon as you can, because you're so limited as a PT based on the number of sessions, and you need to get them as far as you can. So it's like you don't want to do 3 sets of 10 with the light band for 4 weeks and just be like, that's good. You got to add in something more challenging, and that's why I think a barbell is a good assessment of that, because you can just add that in quickly and progress. And like you were saying, you can microload it and just start going with that. But I think that's cool, like we were saying as well. Like if you can get to at least starting to reach that point in the rehab side, and that's where like then you hand them off to like the trainers, and then they continue progressing them. And I think that's why it's important to have these conversations like between trainers and PTs, because like we all need to understand the whole spectrum. I don't think PTs should be ignorant to the performance and strength side, and I don't think trainers should have like no idea what's going rehab wise. Like we should kind of meet somewhere in the middle, and PTs will kind of like take the initial baby steps when they're hurt. But then like we were saying, you're so limited in your time, then you got to pass them on to a knowledgeable trainer that has some understanding of like, and you can communicate with your PT, like this is where they're at now. Now you can kind of just like pick up the reins and kind of start progressing their strength training program, and then you get them to the elite level they were before. So
yeah, it's good to have a circle of professionals and multiple disciplines that you can refer people to.
Yeah.
So we're lucky enough to have a really good PT in town that we refer people to, and then I know we get some business out of that as well too, because it's not just us referring patients in pain, it's them referring patients to us to get to where they want to go.
Yeah, exactly. It's just honestly, if you want to give the best quality care or provide to your patients, like you got to meet them where they want to go. Like, what is your goal? Like, that's the first thing you should honestly ask a patient. Like, and if their goal is to get back into that, I think it's your responsibility as a trainer or as a PT to help them reach that goal, and be realistic and tell them, all right, you do have maybe an injury where it's going to take longer to get there or whatnot. Then that's where you have to understand the knowledge of the rehab side as the PT. But I think all of us should be working together to reach that patient's goal, not just be like, oh, I don't like barbell stuff, so I don't want to get you back into strength training or whatnot. So I think it's, it shows the quality of your provider if they're willing to work with you to reach your own goals. So.
All right, I think that about wraps up our conversation about injuries. Again, that was Mike Alzheimer, the 10 out of 10 man dime, as some people would say.
Yes.
You could
Magic Mike.
Magic Mike. Was his nickname.
Yeah, Big Sky Barbell, unfortunately. Yeah.
I think Katie said somebody needed to smack you with an ugly stick.
Yes.
All right. You can follow Mike at Mike_physio,
yes.
I believe, on Instagram. I think he has 390 followers, so get him 5 more. Get him like 1 or 2 more.
Yeah. Wasted my time.
Mike, thanks for coming in and talking to us.
Yeah, no, it was a good time. Thanks, guys. Thanks for having me.
This has been the Three Little Pigs podcast. Please ask questions in the comments or on our Instagram, and we'll get to them in a Q&A. All right. Have a good one.